everyone. So today we will be covering with a topic urinary tract anti-infective agents. So these are nothing but the drugs that are used in the treatment of your infections related to the urinary tract. So these are the drugs that we are going to cover. We have the chemical class of quinolines. So we will be covering its SAR, nalidixic acid, norfloxacin, enoxacin, ciprofloxacin, ofloxacin, lomifloxacin, sparfloxacin, gatifloxacin, and moxifloxacin. I hope some of the drugs are very common that you might have heard, like norfloxacin, ciprofloxacin, ofloxacin, etc. Okay, in miscellaneous we have furazolidine, nitrofurantoin, and methenamine. Among these classification, we have the synthesis for nitrofurantoin and ciprofloxacin, which will be covered in a separate synthesis related video. So let's study about the synthetic antibacterial agents. Obviously, any kind of infection, the main target is the bacteria that is causing, right? So it is used for the treatment of local, systemic, and urinary tract infections. The chemical classes of these synthetic antibacterial agents include the sulfonamides, nitrohydrocyclic compounds like your nitrofurans, that was example the drug nitrofurantoin, metronidazole, and other quinolones. Okay. Now, as we know, there are some antibacterial agents fail to achieve the adequate concentration in plasma or tissue for the treatment of systemic infections following oral or parenteral administrations that are concentrated in urine, which are effective for eradicating the urinary tract infections. Example is your nitrofurantoin, a nitrofuran, nalidixic acid, which is a quinoline, and methenamine are the example of such urinary tract anti-infective agents. So the antibacterial agents का simple mechanism ये है कि they are not having adequate concentration in plasma or tissues. Okay, whenever given with oral or parenteral administration, they are directly concentrated into urine and they eradicate the urinary tract infections by expulsion of urine. Okay, simply urine. So first class, that is quinolines, wherein we have to study it comprises about the synthetic antibacterial agents that were patented after the nalidixic acid. Nalidixic acid is nothing but the naphthyridine derivative, which was introduced for the urinary tract infection in 1963. So we have isosteric heterocyclic groupings in this class include quinolines, which are nothing but the norfloxacin, ciprofloxacin. Okay, this is the fused ring, that is nothing but the quinoline ring, quinoline, right? And the drugs we have is norfloxacin and ciprofloxacin, lomifloxacin. Then we have naphthyridines, okay, in these drugs, which have the nalidixic acid and enoxin as drugs. Then we have xenolins. You can see the comparison in these three. Okay, the synthetic antibacterial, all the agents like this, all drugs were introduced after 1963, after the discovery of the nalidixic acid. So these are the synthetic derivatives, so in which you have the chemical classes as quinolines, in which you can remember it has one nitrogen and ketone group present. Naphthyridines, so naphthalene fused ring and two nitrogen. Xenolines, we have this at 1,2 position. Okay, nitrogen. Moving ahead with the important points. So clinical usefulness for the quinolines has been largely confined for the treatment of urinary tract infections. Also to remember, quinolines are not only used for the urinary tract infection but also have been shown its effectiveness in the anti-malarial drugs. Alright. As a result, the extensive structural activity investigations leading to compounds with enhanced potency, extended spectrum of activity, improved absorption and distribution property. Due to this extensive structural activity investigation, it has led to the enhanced potency, extended spectrum, improved absorption, distribution properties. Okay. Now, most potent analogs sometimes are classified separately from the urinary tract specific agents that are nothing but the fluoroquinolones, okay, because the rings just have the 6 fluoro substitution, okay. Moving ahead towards the SAR. So in this SAR, you can see this is nothing but a quinoline structure. All right. So this, how can we just name it? So it is 1,4 dihydro. Now why it is dihydro? Because you can see there is no double bond. So it is 1,4 dihydro. Okay. Then this is the fourth position wherein the oxo group is present as a ketone moiety. Then we have 3-pyridine. Okay, this is the 3-pyridine carboxylic structure. If you just see this part, so this is the pyridine ring which is attached to the side chain carboxylic acid. So 1,4 dihydro, yes, 1,4 dihydro 4 oxo 3-pyridine carboxylic acid. Now this moiety which we are talking about, which I have circled here, this entire moiety is important for the antibacterial activity, and that should be annulated with the aromatic ring. If just this moiety is present which is not annulated with this aromatic ring, then the antibacterial activity cannot be shown. So it's just the matter that one along with this moiety, it should always be annulated with the aromatic ring. Isosteric replacements, retention of antibacterial activity. So if there are any kind of isosteric replacements on the nitrogen of nitrogen for carbon atoms at position 2, 5 and position 6, 8. Okay, if there are any kind of isosteric replacement, it will lead to the retention of antibacterial activity. Then we have the substituents at position 2 will greatly reduce or abolish the activity. So any kind of substitutions at this second position will greatly reduce and abolish activity. And position 5, 6, 7. So you can see this is the position 5, 6, 7, 8 of the annulated link must be substituted with for the good effect. So it is just showing that the third point is just saying that if there are any kind of substitutions made on the two, then it will reduce or abolish the activity, while on 5th, 6th and 7th, 8th, that substitution is must be annulated so far as a good effects. For example, it is given piperazine and 3-aminopyrrolidine substitutions at position 7 have been shown to convey enhanced activity on the members of the quinoline class against Plasmodium aeruginosa. Okay, then we have the next point such as 6-fluorine substitution at 6th position. You can see if this 6th position is substituted with the fluorine atom, it will enhance the antibacterial activity. Alkyl substitution at 1st position is essential for the activity, and with lower alkyls such as methyl, ethyl, cyclopropyl, and generally have the greater potency. Aryl substitution at one position is also consistent with the antibacterial activity, which will give the optimal potency. Now, if there is a ring condensation, okay, what do you mean by ring condensation? Fusion at 1,8, okay, 1,8, 6, 7, or the 7/8 position. Like if there is some ring here, some ring here, okay, or some kind of ring here, here and here, so this will lead to the active compounds. Okay, so so the example we have of the ciprofloxacin, which we'll see wherein the piperazine ring is attached. Okay, so what are the SAR points? So first SAR point is कि जो 1,4 डाइहाइड्रो 4 ऑक्सो 3 pyridine carboxylic acid है, that is essential for the antibacterial activity, which must be annulated with your aromatic ring. Okay, then second is the isosteric replacements of will lead to the retention of antibacterial activity. Substitutions at this C2 is will reduce or abolish the activity, while on 5th, 6th, 7th, 8th annulated gives a good activity or good effects. Then fluorine atom at the 6th carbon is give the enhanced antibacterial activity. Alkyl substitutions at one positions like lower alkyl groups will give uh, essential for the activity and will give a greater potency, and even the aryl substitution will give a optimal potency, and the ring condensation at 1 8 6 7 and 7 8 position will lead to active compounds. Okay, now the bactericidal action of the nalidixic acid and it conjures is known to result in the inhibition of DNA synthesis of that bacteria which is causing the tuberculosis. Okay, and that is simply, if more specifically I say, it is inhibition of the bacterial DNA gyrase topoisomerase 2. Okay, you should remember as this have been asked in the MCQ. Alright, so this is just about the nalidixic acid, that its mechanism is inhibition of DNA synthesis, specifically DNA gyrase topoisomerase 2. Okay, and mutations which have been leading to the altered porine proteins can lead to decreased uptake of quinolines and cause resistance. This is not much important point, just to remember that there can be resistance in the body leading to the drugs with the chemical moiety quinolines. Okay, because mutations can lead which can alter or do the porine channel modifications. So the incidence that is relatively lower than 1%. CNS side effects are also associated with the quinolines like irritability, tremor, sleep disorders, vertigo, anxiety, agitation, and convulsion. So we should take a note, and a case study should be done properly while giving the quinolines anti-tubercular agents. Another property of quinoline class, that is adverse effect we are talking, is phototoxicity. So the person may become pigmented, extreme sensitivity to, that is extreme sensitivity to sunlight. Okay, now as we are talking about the adverse effect, one of the tendency of certain fluoroquinolines like your norfloxacin, ciprofloxacin is that in high doses it will cause crystalluria in alkaline urine. Very important, please remember in MCQ the tendency of some fluoroquinolines is that, such as norfloxacin, and you can just remember that fluorine containing. Okay, in high doses will lead to the crystalluria in alkaline urine. Okay, but the excellent chelating properties of the quinolines provide the basis for their incompatibility with antacids, hematinics, and mineral supplements containing divalent or tetravalent atoms. Okay, you can see this is the structure of ciprofloxacin, wherein it is having an excellent chelating property with the quinolines which provide the basis for incompatibility with antacids, hematinics, or other drug interactions. Now we have the classification. Now the antibacterial quinolines can be divided in two classes, that is on the basis of their dissociation properties in physiologically relevant conditions. That is can be classified as first class and second class. First class is represented by the nalidixic acid, oxolinic acid, which is no longer marketed in the United States. Okay, and cyanoxin, which is possess only 3-carboxylic acid as an ionizable functionality. The second class of antibacterial embraces the broad spectrum fluoroquinolines, okay, in which almost all the drugs are covered: norfloxacin, enoxacin, ciprofloxacin, ofloxacin, and lomifloxacin. Now, generally, I mean to say is the nalidixic acid was first discovered, and later on, after the nalidixic acid, the other fluoroquinolines were synthesized, which have a broad spectrum of activity, that are your norfloxacin, enoxacin, ciprofloxacin, and other drugs. Okay, now it also, in addition to the 3-carboxylic acid, it also has a piperazine functionality at the 7th position and 6 fluoro substitutions. Okay, so as it is a fluoroquinolones, you will observe there is a 6 fluoro substitution along with the piperazine ring at the 7th position and 3 carboxylic acid. So these are the important structural features of the antitubercular agents. What are the structural features? 3-carboxylic acid, basic piperazine functionality at 7th position and 6 fluoro substitution, and which will have the pKa value from 8.1 to 9.3. Okay, so this is the structure. So this is the ionization equilibria in the quinoline antibacterial agents, which is removed from your syllabus, so it's not important. Yeah. First drug we have, that is nalidixic acid. You can see this is the marketed product, look how it looks like. So in nalidixic acid, you can see you have the scaffold as naphthithyridine. Okay, and obviously, as I said, there will be 3-carboxylic acid as a important feature. It is used in the treatment of urinary tract infections, again the gram-negative bacteria. The 7-hydroxymethyl metabolite of this is significantly more active. Okay, now